Hi, so we're going to be talking about how to set up a PCA pump in this video. So as you can see here, I have the PCA module attached to the brain, and it's on the right hand side of the closest location it could be. That's the only way this pump is going to work. And then I have already set up here is a 250 normal saline bag on another line here. So this is kind of the setup you're looking for. This one has some extra channels. You don't really need those unless you have other like medications going. And then I've already obtained the keys from the Omnicell, but you would want to get your PCA keys from the Omnicell in order to program the pump. So we're going to zoom in a little bit just so you can see what I'm doing. But when you are ready, the first step you would do is get all your materials, set up your normal saline. And then we will start by opening or unlocking this PCA and turning the machine on. So you can see here, locked is at the bottom, unlock is at top, and then on the side you have program. It starts locked, so just unlock the PCA. That's how you're gonna open it up. And obviously you can turn the system on as you do with the pump for all the other activities. So I have already obtained our medication here. This is cranberry juice. We're gonna say it's morphine or whatever PCA you wanna say it is. So we have 25 cc's of juice here. And this is the PCA tubing that you can obtain in your supply room. So I just attached it there. I have not primed it or done anything with it because we're going to use the pump to prime this through. So you can say new patient. If you work in the ICU, you'll press special care, but if you work in the med-surg unit, you'll just go to med-surg. And then you can set this up. So this is a little bit of a locking mechanism here. I don't know if you can see it with these keys in the way. There we go. So this kind of locks into place, and this opens up the flange and can move up and down. So when you're putting in the PCA, you want to have the dose and the information visible. And so you want to get these under the lips here, and you want to, move this out of the way. You'll get this under here, and then you want to lock these around the base, and that's going to control how the syringe is pushed in. And then you just lock it back into place, and you can close this and go to program. So you'll press channel select to open up your PCA. You'll confirm the time of day, and then we use the BD Plastipack, and you'll press confirm. So you can choose, I said this was morphine, so we'll say it's morphine. And we had 25 mLs, 25 milligrams. So the PCA, you should definitely be monitoring SpO2 while on the PCA. Certain patients, you should use the end tidal CO2. There is a module for the Alaris pump that can monitor EC CO2 if you decide that that is needed. The doctors will sort of determine when you need that. So you'll go through this, and you should always be setting up a PCA with 2 nurses. So I have my videographer here, would be my second nurse verifier. And you have some options on what you're gonna do. So for example, a surgical patient might be doing the PCA, whereas someone on CMO might be just getting a continuous infusion, or someone could potentially getting both. Let's say we have a CMO patient, we're doing a continuous infusion and it's going at 1 milligram per hour. We'll press confirm, and we need to lock the door. So we now move the key to the lock position. So you could, if you had primed this tubing externally to the system, you could just press start. If we were in the PCA mode, you'd have to put in the lockout time and the bolus dose and stuff like that. Because we did the continuous dose, it's just, you can have your pump prime this tubing for you. So you will go to options, and then you have all these options here. You'll go page down to prime set with syringe. You turn the key to the program mode, and then you hold down the prime button, and hopefully you'll be able to see. We used a red juice so that hopefully you could see this here, but it will slowly prime. It is a little bit visible. So it will prime, and you want to prime to the Y site. Now, we've done this for training a few times, so we do have a little bit of water in here. Don't worry about that. We're looking at the red. So we want to prime to the Y port here. There we go. So we primed to this Y site, and that's all you want to do, and it monitors the volume here for you. So you can know exactly 2.2 mLs was in this priming setup. So once you've primed to this Y site, you also need to prime this area where your normal saline is going to go. So you can just get a flush. I don't know if I'll get flush barrel to dump this in. You would get a flush and prime this area right here through to this tubing. And that way you have a system that has morphine or whatever medication up to that Y site, and the rest of this is just your saline. So then this could be hooked up to the patient. And what we would do is we would take our saline line here and attach it to the Y port. You can press start on your PCA and make sure you lock it or it will beep at you. And you can press start on your PCA here. Now, if you have a continuous dose, this will just infuse. If you have a PCA, you would have to make sure that you give the patient their patient dose button, and they could press it. This one is on continuous mode. It's not going to work, so you don't have to give this to the patient, because in this scenario, this patient's not using the PCA as a continuous infusion. And that's about it. When you're done, you want to make sure that it's locked and that you remove your PCA keys and you return these to the Omnicell. When it's time to, every shift you should clear this. So when it's time to clear out the system, you go to channel select, confirm, and you're going to go to options again, and you're going to go to patient history, and this will tell you how much has been given, how many demands, stuff like that. You can press the zoom button to change the time frame here. So zooming to 24 hours will show you all day. Whereas if you're just doing per shift, you might want to do 8 hours if you want to see the last 4 hours. Most PCAs have a 4-hour lockout, so you can't give more than X amount of milligrams in 4 hours. And then at the end of your shift, you would want to clear that history, and that way you start fresh for the next shift. And you can exit this when you're done. And that's about it. When you're done with the drip, you do want to wean these off, but when you're done, you would just turn the channel off, and you can get the exact amount left over to waste, turn this off, and you would unlock the pump and take it all down. I hope that helped on how to set this up. And as always, refer to any of our PCMs or patient care guidelines if you are having trouble. Thank you.